Hello everyone, Dr. John Bartemus here today to talk to you about a topic that is often overlooked in many chiropractors' offices and every medical doctor's office. And this topic is the topic of trigger points, specifically latent trigger points. Now, there are two types of trigger points. There's active trigger points, which are painful without touch and refer pain without touch. So everyone's had one of those where you have a trigger point in your muscle and it causes pain and pain at the site and potentially referred pain elsewhere without anyone having to touch it, just based on movement. Latent trigger points are trigger points that you don't know are there because they're asymptomatic until someone gets in there and digs and finds them. But once they do find them, they do cause pain at the site and may cause pain in a referral pattern. So latent trigger points are very important because research is showing that even though they're asymptomatic to you until I go in there and find them, they are interfering with muscle function and performance, whether you know they're there or not. Okay, so this is an area where it is very important to be assessed and receive care if performance is a goal of yours, or if you're paid for performance, or if you just want to prevent long-term injury, as we will see. So one study in the Archives of Physical Rehabilitation found that when doing muscle EMG to the trapezius, on a trapezius with a latent trigger point versus one that doesn't have a trigger point, the EMG activity was higher in the muscle with the latent trigger point. Now what EMG measures is muscle activation. So just standing here at rest, if I was being observed or tested by EMG and I had a latent trigger point in this trap, then this trap would be firing more than this trap, meaning even when I'm at rest, this muscle is working more and expending more energy than this one. Okay? And what that leads to is if we don't take care of that latent trigger point could become an active trigger point and actually cause pain to you without my touch and cause referral symptoms. Or it may never become an active trigger point, but it could still be there as a latent trigger point and cause early elevation of the scapula when I lift my arm, okay, which long term could lead to an impingement syndrome in the shoulder, which is painful, which does require rehab and does require seeing a chiropractor. Okay, so it is important to take care of the latent trigger point to prevent long-term impingement syndrome of the shoulder. Now, also it helps to restore normal shoulder function by removing that trigger point. Another thing that getting rid of the latent trigger points does is it improves what's called reciprocal inhibition. Now, the concept of reciprocal inhibition is that between two antagonistic muscles. So we'll talk about the quad and the hamstring. If my quad is tight, reciprocal inhibition says that to loosen it, I could activate my hamstring, because you cannot activate your quad and your hamstring maximally at the same time. Just like I can't flex my bicep and my tricep at the same time. So if my tricep was tight and sore, I could reciprocally inhibit it by flexing my bicep, therefore taking some of the stress off the tricep. When looking at reciprocal inhibition with latent trigger points, researchers in the Journal of Pain found that the latent trigger point causes an incomplete relaxation of the muscle that the trigger point is in, as well as its antagonist. So the latent trigger point doesn't let my tricep relax. It's in my tricep, doesn't let my tricep relax. There's increased EMG activity in that tricep, but it also blocks the complete relaxation of the bicep. Okay, so it doesn't allow for reciprocal inhibition of the bicep, so then the whole arm is suffering, or the whole leg, or wherever this trigger point is. Okay, so that is major when it's coming to performance or relaxation post-exercise. You want those muscles to be able to relax, but if you have this increased muscle activation where the trigger point is, that muscle doesn't relax fully, neither does the bicep. And that leads to imbalances of muscle activation. So greater chance that you have a strain, sprain, injury because you are not activating properly. Okay? Lastly, another study in the Journal of Pain found that latent trigger points accelerate fatigue in muscles. So this makes sense, right? If I have a trigger point in my trap, a latent trigger point, with increased EMG activity already, it's already working too hard even at rest, or more than it should even at rest, right? So then I go to exercise, say do a CrossFit workout or go to the gym and do a bodybuilding workout. Just put that muscle under demand. That muscle with the latent trigger point is going to fatigue faster because the motor units of the trigger point are already working too much. Then when I put that muscle under stress or use that muscle, the motor units surrounding the trigger point are overloaded because they're having to do more work due to the trigger point already maxing out its work. So therefore the entire muscle fatigues faster and your performance suffers and you're at risk for injury sooner. So you can't perform as many reps or as much volume as you would be able to without the latent trigger point. So whether you're a weekend warrior, a high-level CrossFit athlete, or anywhere in between, being assessed by a professional for latent trigger points and having those worked on and removed will increase your performance and decrease your risk for long-term injury in the area where the trigger points are. I'm Dr. John Bartemus, and I provide chiropractic care, soft tissue care, cold laser, and many other services to help ameliorate latent and active trigger points and increase your health and your function. Give me a call today, www.acceleratechiropractic.com. Have a great day.